My name is Jennifer Schleiman, Senior Vice President of Communications and Governance at the National Health Council. In addition to my day job as a patient advocate, I'm also a patient, managing a chronic condition and beating cancer twice. Today, we're here to talk about how heart health and kidney health are connected, and how factors like type 2 diabetes and high blood pressure can raise that risk of heart and kidney disease, and what meaningful steps you can take to manage your risk. Many people are unaware that there is a simple test known as the uACR, which can identify kidney damage early. We'll also discuss how patients and their caregivers can advocate for themselves and work with their healthcare providers to share decisions on testing and treatment. The National Health Council works to bring together and give voice to the more than 200 million individuals living with chronic illnesses and disabilities, as well as their family members and caregivers who support them. We focus on helping people get the healthcare they need that is affordable and accessible to everyone. Our work is supported by a network of nearly 200 national patient organizations and health-related companies. I am thrilled to be joined by a panel of trusted messengers, a group of fellow patients and advocates who have graciously agreed to share their unique perspectives and experiences related to heart and kidney health. As always, we encourage you to talk to your trusted healthcare provider for medical advice and to make your own plan. I'd like to begin by welcoming Patrick G. Patrick is an active member of the kidney disease and diabetes advocacy communities, particularly through the American Kidney Fund, the Kidney Health Initiative, and the American Diabetes Association. He was diagnosed with type 2 diabetes in 2003 and with end-stage kidney disease in 2013. He underwent kidney dialysis for 4 years before receiving a kidney transplant in 2017. He is dedicated to expanding access to care for individuals living with diabetes, high blood pressure, kidney disease, and heart disease. Thank you for being here, Patrick.
Thank you for having me.
We are also joined by Thelma Barber. Thelma is a patient advocate who is actively involved with the National Kidney Foundation and the Kidney Health Initiative. She is a 2-time kidney transplant recipient who lives with type 2 diabetes and a chronic autoimmune kidney disease known as IgA nephropathy, IgAN, or Berger's disease. She is passionate about advocating for all individuals living with kidney disease, especially those in the African American community, and those who may lack access to healthcare or kidney transplants. Welcome, Thelma.
Thank you so much for having me. I appreciate you.
Thank you. Finally, I'd like to introduce Mitzi Franklin. Mitzi's heart disease journey began at 16 when she was diagnosed with high blood pressure. She also lives with chronic kidney disease and type 2 diabetes. Mitzi has devoted herself to learning about the connections between these 3 conditions and sharing what she learns with others in her community. She supports her neighbors by accompanying them to medical appointments and encouraging them to advocate for themselves with their healthcare providers. She is also a caregiver to her parents. We are thrilled to have you on the panel, Mitzi.
Thank you so much.
Thank you all for being here. Let's jump right in. I'm going to start with you, Patrick. When you first learned you needed dialysis in 2013, you were stunned because you didn't know type 2 diabetes could lead to kidney failure. Please talk about that experience and what you wish you had known earlier.
So when I first received my diagnosis, it really did catch me off guard because the 10 years prior that I was going to my endocrinologist, they never told me that diabetes was the #1 leading cause of kidney disease. Mm-hmm. So for me, I mean, it just really stunned me in that moment. And what I wish I would have known was about the connectivity between diabetes and kidney disease, which, growing up in a low-income community, I never heard diabetes. All I heard was sugar and things like that. So yeah, just to be able to receive health literacy on diabetes and the connectivity to kidney disease would have been extremely beneficial for me at that time.
That is so important. And as a follow-on to that question, Patrick, I'd like to ask you, as an advocate focused on being a voice for the voiceless, who do you think is at highest risk for kidney and heart disease? And why is it so important to raise awareness in underserved communities, especially among those with diabetes or high blood pressure?
For me, it would be the minoritized communities, the impoverished communities, rural communities, communities that are underserved and underprivileged. Those particular communities don't get the health literacy. They don't have organizations or people that'll be boots on the ground and meet them where they are.
Anything to add, Mitzi?
Well, yes, I wanted to add, I agree with everything that he just said. I'm also coming from a small community of about 1,200 people. And I talk about this a lot, that we're country folk, and a lot of people don't understand the medical lingo. What I would like to also stress to that is it's important to know your numbers and to know your family history. Because once people start diving into their family history, they see, oh, there's a long line of diabetics. A lot of people, they get the diagnosis and they're going, where did this come from? Not knowing that grandmother, aunt and uncle, mom and dad, brother Joe, it's come full circle.
So know your numbers, know your history.
Know your history. It's important for sure.
Great. Many don't know that the uACR test is a simple, accessible urine test that can detect early signs of kidney disease. Thelma, can you please tell us how you first became aware of the uACR test?
I was getting those tests with my nephrologist, and after researching and learning the interconnection of everything and how the uACR is important, him and I started having conversations about it. And he explained to me, oh, well, this number shows the albumin in the urine, and if starts to show if you're having issues with your kidneys, and it also can detect if you're having issues with your heart. So what I would say is when you go to the doctor, do your best to prepare yourself with questions. And when you go in, understand that it's a partnership, okay? You need to be willing to partner with your doctor and have these conversations, but most importantly, don't show up to be talked to. Let's be talked with. And let's understand that you need to take and have a huge role in your health.
That is so important. Now, Mitzi and Patrick, why do you think it's valuable to receive regular uACR tests?
So it is important for me to know my numbers, to be able to have dialogue with my physicians, the nurses, the entire care team on how my kidney is progressing, to make sure I don't have that protein leaking out of my kidneys, to make sure, because I'm diabetic, to make sure that my A1C and my glucose levels are very stable and normal, so that I can continue to lead a very healthy life.
Mitzi, how about you?
So it's just important to, like Patrick said, to know your numbers. And I also kind of wanted to add and piggyback to Thelma, because things like this are important. Because all three of us, sure, they were doing these tests, I didn't know what the test really meant. And it wasn't until I was kind of in trouble that they started explaining the levels and what the tests meant. But things like this are important because we're getting the word out there that, yes, you need to ask for this test, but this is why. And this is kind of what it needs to look like. Even though our bodies are different, our numbers are different, it's just important to get the word out there so you can start the dialogue.
So it would be like when your numbers aren't in the danger zone, still good to have that conversation with your physician so that you can be preventative.
Yes.
Absolutely,
Key
yes.
preventative.
Yes, keyword, preventative, yes.
Excellent. Thelma, my next question is about accessing screening tests. Recently updated treatment guidelines for hypertension, diabetes, and kidney disease recommend uACR screening for individuals living with high blood pressure or type 2 diabetes as a way to identify kidney damage early. And yet many people don't receive uACR screening unless they ask for it. What advice would you give to someone who would like to start a conversation with their healthcare provider about uACR testing?
I believe the conversation when you're interested in having this testing done is to just say you're concerned. And I think that starts the dialogue off with the doctor, and they should say, well, concerned about what? Well, I'm concerned about my kidney. So are there any testing, or is there testing that could be done?
So we've been talking a lot about the uACR test. If you want to just talk about it in lay terms with your doctor, what kind of test would you ask for? Like, what's the difference between like a regular urine test and the uACR?
Well, I know for me, when I think about uACR, I need to know if I have protein in my urine. I need to know if I'm dealing with a leak or damage to my kidney. Am I suffering from acute kidney injury or anything like that? So for me, I would definitely ask for that specific test, the blood test and the uACR test, to make sure that, my new kidney is now functioning, because that's what caused, that was, the implication for the failure, because I had so much protein in my urine.
Yes, agreed. Good answer.
Yeah.
Awesome. So, Mitzi, an important part of advocating for your health is participating in decisions about your care rather than having a healthcare provider make all the decisions without your input. That's really commonly referred to as shared decision making. So what are your thoughts about the importance of shared decision making?
It's super important, and if I didn't believe in that philosophy, then I probably wouldn't be sitting here today to talk about it. After my second open heart surgery, I just did not feel good. And I knew something was wrong. And they kept telling me, no, everything is okay. You have to advocate, because I live in this body and I know when something's not right. It was a hard, strenuous journey, but I just kept going until I found someone who would listen.
So Patrick, in the interest of laying the groundwork for effective patient advocacy and shared decision making, what advice can you share with our audience about how patients and their caregivers can prepare for medical appointments so that goals and concerns are heard by their healthcare professional?
One of the first things that I would recommend is becoming familiar with your electronic health records. Read your summary, and then develop your questions around what was last said, and then what's on your mind. So there's nothing wrong with getting a pad, a journal, and going in there and say, hey, doc, how you doing? Here's what I need to know. Number one, can you tell me the results of my UAC test and my blood test? Can you break down exactly what that means? How is my kidney functioning? Can you tell me about my creatinine level? Can you tell me about my albumin? this is your life. This is your body. If you don't learn to speak up, who else is going to do it?
Yeah, so important. So how about you, Mitzi? I know that you support members of your local community by going with them to their medical appointments. As a caregiver and or patient partner, if you will, you probably have learned quite a lot about patient advocacy. What lessons and tips can you share?
So again, to kind of touch on what Patrick said, in my healthcare system, providers have X amount of time. So if you have like 3 things going on, they're gonna tell you, I don't have time for 3 things, like today, what's the focus? So I do, especially like my parents, let's sit down before we go. What are the top things that we need to speak about, that we need answers to at this appointment tomorrow? Because we can't be getting off into the woods about, oh, I have a hangnail, like my feet. We got to stay on task. Yeah. And I think that's the most important thing. You have to stay on task.
Absolutely.
Yeah.
And if I can also add to that, it lets your providers know that you are taking an interest in your health, which means that when you go back, they are excited to see you and want to know what you have learned, because I really think providers get excited the more patients are informed.
Historically, we grow up having the ideas that the doctors, this hierarchy of position where we're not supposed to question them. Whether that's the police, that's the doctor, or anybody in authority position, you're supposed to just step in line and do what they tell you to do. And we have to get away from that. And I think that that's what culturally has, put us in a position where we don't feel empowered and we're going along, doing whatever they tell us to do and not questioning it.
I almost hate to say this, but I really just want to wrap up our conversation today, kind of going back to the topic, making that connection between heart and kidney disease. I'd like to ask each of you, what would you want viewers to take away from today's conversation? Patrick, let's start with you.
I want viewers to understand that there are credible organizations out there that will be able to give you not only the answers, they can tell you about your rights, because as a patient consumer, you do have rights to receive equitable and adequate care, health care, and access to it. But also to understand that we only have one body. And again, we can't always depend on other folks to speak up for themselves. So you're going to just have to come out of your comfort zone and learn that this is your body. This is what I'm going through. If you don't understand, please ask. And if they say, well, we don't know, then keep going until somebody knows and can answer your questions. That is my biggest takeaway that I want everybody to get.
Mitzi, how about you? What's the biggest takeaway?
So my biggest takeaway would be, again, to reiterate that it's all intertwined. And so you have to be vigilant about everything, all aspects. The other thing that I would hope people would take away from this video is that, we've been through it. You can do things that can prevent or help certain things. But if you go through something traumatic, if you go through something gut-wrenching, again, something beautiful can come out from it.
Thelma?
In my head, I always have these lyrics so I can kind of help people to educate them. These are the top 3 chronic conditions. The cardio, kidney, metabolic conditions. So please, please, please partner with your doctors. Talk to them about that EGFR the uACR, which is a urine test that we want you to have done so we can make sure the kidneys are working properly. Why? Because that test shows protein and that's not supposed to be there. It is important for you to be a true stakeholder, and please get off the bench and be a partner with your doctor. Take your health seriously. Do not let anything go undetected because it's not supposed to be there. It's not okay. Please get tested.
Any other final thoughts?
Yes.
Yes, Patrick.
And this is directed to the men. Men, you know we're hard-headed. I'm the president of the Hard-Headed Man Club. I know you're going to say you don't have time. I know you're going to say that, well, I can't afford to go and get this test done. I can't afford to miss any time off of work. You can't afford to leave your family and die. You cannot afford to be a burden, especially if you are the breadwinner or you are the head of the household. So make this decision and invest in yourself.
Patrick, what a powerful, powerful message. Thank you so much. And this has been such a great discussion today. I want to thank you all for participating today, sharing your insights on this panel. By doing that, you've really helped to inform the community about the connection between type 2 diabetes, high blood pressure, heart disease, and kidney disease. Your perspectives will inspire viewers, I know they will, to advocate for their health with their care teams and to raise questions about testing tools such as that uACR test. And we really thank you for that, bottom of my heart.
And thank you.
To those of you who are watching at home, thank you for joining us. The National Health Council supports patients and their family caregivers to optimize your health and receive the care you need and deserve. We believe in the power of health education, and we hope the information discussed today is valuable to you and your loved ones. We encourage you to share this information with your families, friends, and communities, and help spread the word about the role of uACR screening in the early identification of kidney and heart disease risk, especially for those of you living with type 2 diabetes or high blood pressure. Talk to your healthcare provider about uACR plus EGFR testing for a comprehensive kidney health screening. Visit our website on your screen now for more information and for useful tools to help you talk to your healthcare provider about this important issue and develop a personalized plan that best supports your health and well-being. Thank you.